I'm Peter Block here in Orlando at AHA 2009, and today, two important trials. First, a non-randomized registry of patients with ST segment elevation myocardial infarction treated at hospitals with PCI, with and without backup surgery, and then, of course, the Arbiter 6 HALT trial, the ezetimibe versus niacin trial. So let's begin with the SOS study, the surgical backup study for patients with ST segment elevation myocardial infarction going to hospitals with and without surgery. Bottom line here, Chris, is that it turns out that there is no difference in outcomes. Myocardial infarction is no different. Target vessel revascularization is no different. This is at 1 year. And the interesting thing is that repeat revascularization is something that is increased in patients that go to hospitals without surgical backup. Exactly what that means, I'm not certain of. Do you have any ideas about that, Chris?
Well, it's an important question of should primary PCI be done closer to the patient where you can do it more timely, or do you need the surgical backup for the few complications? This is very reassuring. It's from the MASDAC registry. The idea of needing further revascularization may be that at the community hospitals they would do the target lesion and then need further revascularization later. Certainly it didn't impact on the hard outcomes of death or MI, so I think encouraging that this looks like a reasonable strategy to distribute a little bit further primary PCI.
Well, the trial that has everybody abuzz here at AHA is the Arbiter 6 HALT trial. So, Chris, why don't you, this is one of your favorites, so why don't you outline what this trial is?
Well, certainly this is a study that looked at carotid intima media thickness and compared adding niacin on top of a statin versus adding ezetimibe, and found a greater reduction in carotid intima media thickness when adding niacin after a period of 14 months. The trial was stopped early, actually, because of this finding. Much has been made of clinical events. There were 9 versus 2, which is obviously a small number. It's actually the 5th study looking at markers of atherosclerosis finding a benefit of niacin. And so many of us are looking forward to the clinical outcomes trials that would look at the safety of adding niacin on top of high-dose statins as well as the clinical efficacy. So very promising for use of niacin. Overall.
Well, you know, as I look at this study, Chris, it seems to me that there's no doubt that niacin is better than ezetimibe as far as intima medial thickness is concerned, on top of a statin. Yep. Very important to say that. The other issue, of course, is sort of so what? Because the clinical endpoints here are so small, the numbers are so small, I think we can throw them out. Don't you agree with that?
Well, we do need large trials to give both safety and real clinical outcome information. And one of the issues is, should we be aiming to start focusing more on raising HDL? And I think this is encouraging of that. I think we do need to continue to work on lowering LDL. That is where the evidence base is, and our guidelines are currently. And so that should remain a focus. And I think it's encouraging that HDL raising has a very great promise to it.
Yeah, it certainly seems that raising HDL still has some benefit, no question about it. But where we go with the lowering LDL versus raising HDL is still somewhat at issue, isn't it?
Yeah, and I think the answer is likely both. So these are complementary, actions, and hopefully this will be sort of the next big thing of raising HDL on top of aggressive lowering of LDL.
Well, further trials coming, and we'll wait and see how all those come out. I'm Peter Block for CardioSource News with Chris Cannon.